Hello, I'm Dr. Robert Moran, and I would like to welcome you to Wellington Retreat. As an addiction psychiatrist and addictionologist, I've had a great deal of experience treating people in various detox and rehab centers. Although most are well-meaning and try to do good work, I often found that something very significant was lacking in the overall care. Too many people were leaving programs prematurely, and even if they completed, it wasn't long before they were using drugs again. It was thought that it was because the addicted person had not yet hit bottom, or simply did not want to stop using. Now we know this really isn't the case. Medical research has taught us otherwise. For too many years, the field of medicine virtually ignored addiction. It was felt that all we could offer was a referral to AA. But quite a bit has changed in the last few years. Now we have an entirely new medical board specialty of addiction medicine. Research is booming in addictionology. We're learning a tremendous amount about how drugs and alcohol literally change the brain and what drives people to continue to use drugs even when terrible things are happening and their lives are completely falling apart. Many people with addiction, possibly most, also suffer from other significant psychiatric problems, such as anxiety, depression, attention deficit hyperactivity disorder, personality disorders, bipolar disorder, schizophrenia, and others. Often, the substance of addiction is worsening the symptoms of the psychiatric disorder. Or, the untreated psychiatric disorder is fueling the addiction. And finally, substance intoxication may look like a psychiatric disorder. The failure to recognize these complex illnesses is often the reason for premature termination from treatment. What looks like laziness and lack of motivation can be easily recognized by the addiction psychiatrist as either a negative symptom of schizophrenia, inadequate brain stimulation in attention deficit hyperactivity disorder, or apathy in depression. Instituting the appropriate treatment for this co-occurring disorder frequently leads to dramatic improvement in response to addiction treatment. Addiction is a brain disease, and far too many people who suffer from this devastating disorder are not receiving the proper treatment. No longer is the act of using alcohol and drugs considered a social or behavioral disorder. Research has shown us that it is no less a disease than diabetes or cancer, and it must be treated as such, diagnosed by the only people properly trained to take a history and make a diagnosis: physicians. This is what I came to realize was missing in so many treatment programs, so I put together a team that would change this and stop providing treatment as usual. Now the medical community is leading the fight against the disease of addiction. We now have the research to prove the helpfulness of medicines and formalized psychotherapies to markedly decrease, and in some cases completely eliminate, craving or desire to drink or use drugs, as well as learning effective ways of coping with craving and getting back on track to normal, healthy development. Wellington Retreat presents to you a treatment model supported by medical science.